I am Dr. Mustafa. I have 20 years of experience in dermatology and I practice in dermatology. Today we will understand the basics of skin allergy and some common skin diseases and their management. Nowadays, patients are frequently coming with various skin problems. Therefore, it is crucial to be familiar with treatments for several common skin disorders including dry skin, acne, psoriasis, fungal infection and dermatitis. There are hundreds of skin conditions that affect humans. The most common skin condition can have some symptoms that are similar, so it is important to understand the difference between them. People should work closely with the dermatologist to diagnose and treat any skin condition to ensure that the lifestyle is not affected. Below are the most common skin diseases separated by type. Permanent conditions. A number of skin conditions last a long time. Some may start in childhood and continue into adulthood. In some cases, the condition will not always be present but will flare up at certain times. Seborrheic dermatitis. In adults, seborrheic dermatitis may appear anywhere and is prone to flare up and disappear for the rest of a person's life. The affected skin may be reddish, swollen and appear greasy. A white to yellow crust may appear on the surface of the skin as well. Many treatments help to bring relief from symptoms. In babies, this is common known as cradle cap, greasy and scaly patches of skin form on the baby's skin, most commonly on the scalp. It is harmless and usually goes away on its own. Moles, common growths on the skin that appear when the skin cells bunch up with the tissue surrounding them. Most people have moles and may develop new ones from time to time. Moles have no symptoms but should be regularly checked if they grow larger, appear normal or change in color. Melanoma, abnormal moles may lead to melanoma, a serious and life-threatening skin cancer. It may have symmetrical shapes, ragged edges, uneven colors or change in size. They should be checked. Patients with melanoma may have surgery or undergo chemotherapy or radiation treatment. Rosacea. The skin condition rosacea is most commonly associated with redness. However, there are 4 subtypes that cause other symptoms as well. Eczema telangiectasia rosacea causes the typical redness, visible blood vessels and flushing. Ocular rosacea can cause red and irritated eyes, swollen eyelids and symptoms that looks like a style. Papular pustular rosacea causes redness, swelling and is accompanied by breakouts that look like acne. Psoriasis rosacea causes the skin to thicken and have a bumpy texture. There is no known cure for rosacea, but symptoms can and should be treated to keep the condition in check. Lupus is a common disorder that varies from person to person. The disease attacks the immune system, causing inflammation and pain. While lupus can affect any part of the body, symptoms of the skin include red patches or ring shapes on the skin, sunburn-like rashes on the nose and cheeks, or circular rashes that don't itch or hurt. These may be accompanied by other symptoms such as headache, fever, fatigue and swollen, stiff or painful joints. Treatment includes various strength medication designed to help minimize the damage caused by lupus. Psoriasis. Psoriasis is an autoimmune disorder. Symptoms include patches of abnormal skin. The affected skin is typically red, scaly and very itchy. The affected area vary in size and severity. There are 5 main types of psoriasis. Block psoriasis causes thick red patches of skin. Pustular psoriasis causes pustules around the surrounded by red skin. Erythrodermic psoriasis causes patches of skin that look like severe burns covering large portions of the body. Inverse psoriasis causes a shiny red rash in the folds of the skin. Gutted psoriasis causes small red spots on the scalp, face, torso and limbs. Eczema. The condition is commonly found in infants and young children, though it continues into adulthood as well. Symptoms include rashes on the face, scalp, behind the elbows or on the neck, wrist, ankles or legs. The rashes are very itchy and may become bumpy, change color or thicken. In adults, the rashes may cover more of the body, causing very dry skin that is permanently itchy. There are few different types of eczema, each causing their own symptoms. There is no known cure for eczema. It either clears up on its own, or the symptoms are treated with medication and creams. Vitiligo is the loss of pigmentation in the skin. While white patches of skin are the main symptoms of vitiligo, are more commonly occur in the area where the skin is exposed to sunlight. People with vitiligo often lose their hair early as well. For some people, the symptoms are in one area, while others find that it spreads slowly over many years. There is no cure for vitiligo. There are some medical and surgical treatment options, though they are not right for everyone. Temporary conditions. Acne, one of the most widespread skin condition. Acne comes in many forms. Pustules are the commonest red pimples that have put up their tips. Papules are the raised red bumps caused by infected hair follicles. Nodules are the painful lumps that lie underneath the surface of the skin. Cysts are the typically larger, painful, pus-filled infection that lie beneath the skin. All types of acne are commonly treated with creams and sometimes medication is necessary. Hives. Hives are itchy wells that are raised up from the normal layer of the skin. They may be caused by an allergic reaction in the body of outside factors such as stress, illness, or even light clothes. Hives are treated with antihistaminic and preventive practice. Please consult your dermatologist for treatment. Warts. The common raised bumps on the skin known as warts are actually caused by the human papilloma virus. Warts are contagious and can appear on any part of the body. Common warts typically grow on the hands, feet and joints. Though they can appear anywhere, they often go away on their own, though unusually warts can be treated with liquid nitrogen or medicated creams. Fungal nail infection, a condition in which fungus lives near, under and around the nails, usually in the feet. The fungal builds up, causes the nail edges to crumble away, producing white yellowish scaling and flaking on the surface of the nails. Treatment is usually anti-fungal cream or other fungal treatment. Please consult your dermatologist for treatment. Cold sore. A cold sore is red fluid-filled blister usually found near the mouth. The sore itself is painful or delicate. Other symptoms include itching or burning sensation on the side before the sore is visible. Cold sores are caused by the herpes simplex virus and there is no known cure for the virus. The sores may return and last up to 2 weeks. Medical treatment includes creams and medication. Please consult your dermatologist for treatment. Candidiasis. The overgrowth of the Candidus albicans fungus on the body is called candidiasis. The causes irritated patches of skin usually found in the armpits, groin or underfolds of skin such as the knee. Candidiasis can usually be prevented with home remedies, proper hygiene and avoiding the overuse of antibiotics. Athlete's foot. A rash caused by a fungus that rapidly multiplies in warm, damp conditions such as athletic shoes. Symptoms include dry, itchy, red skin. The skin between the toes or under the foot may be soggy while cracked or scaly. it often itches and causes soreness. The problem usually arises quickly. Other food is treated with medical ointments and good food hygiene. Any problem?